Winter season is here. You know what that means. Many viruses are at their peaks. While the weather is much nicer, the colder temperatures or low humidity levels cause these winter viruses to wake up and spread from person to person. Dr. Reena Mehta has more. Hey, doctor, how you doing?
Hi.
Merry Christmas Eve to you.
Merry Christmas Eve to you as well.
But unfortunately, we're talking about sicknesses and illnesses today. So I know I feel like I was just getting over something of my own. Why is it this time of year? Is it just something that we see more, or is it actually happening more?
So it's actually happening. So obviously we love the weather. Everybody loves the weather right now. But like you said before, the colder temperatures and low humidity levels actually cause these viruses to sort of surface, come up, and basically replicate and infect people. And so really it's this winter season, typically from December to March, that we're talking about. And
add that in with all of the get-togethers that we're having. There's a lot of holiday cheer, a lot of hugs, a lot of close quarters. That doesn't really help things, does it?
Exactly. And so, you know, there are definitely things that you can do to try to stay healthy this winter. If you know that somebody is sick, maybe stay home, stay away from that person. If you develop a fever, stay home for at least 24 hours until the fever has subsided. Also, it's important to try to keep those germs at bay. So good hand hygiene, wear face masks, and if you think that someone might be sick, maybe stay away from them at least by 6 feet. That can help. Disinfecting countertops and surfaces can also be of quite help as well.
So some people might say, okay, I've got plans this Christmas, something for the holidays, maybe a trip. They start to get a little sniffle and they say, I got to go right to the doctor. Is that always the best option?
That's not always the case. Most of these viruses, and just to know, there's over 200 viruses that can cause illness this winter season. And so we always think of flu, which is a common one, and also the common cold caused by things like RSV and rhinovirus. These viruses are typically mild. And so they usually do cause things like fever, sore throat, cough, runny nose, but most of them can be treated at home with good rest, hydration, and over-the-counter medications. However, if your symptoms are severe and lasting a long time, then it's probably a good idea to check in with your primary doctor.
Speaking of severe, the flu can really knock someone out, right?
Yes, so we are entering flu season. We're already starting to see some cases in Louisiana, and flu season typically peaks in January and February. And so, you know, last year's flu season was horrendous, record-breaking hospitalizations, the highest number of pediatric deaths. So it can be a scary time, but this year's flu shot has actually been updated to include 2 influenza A strains, H1N1 and H3N2, as well as 2 additional influenza B strains. So hopefully we're in better shape than last year.
And you recommend wholeheartedly get that flu shot?
I do. So the CDC recommends that anyone over the age of 6 months can get the flu. And the thing about the flu is that, you know, it can make people really sick. Those babies and toddlers, pregnant women, people over the age of 50 can get really sick from the flu. So while it's not 100% effective, we have all seen that. People say all the time, you know, I got the flu shot and then I got the flu. It's important to note that there are at least over 199 other viruses that can also get you sick. But if you do get your flu shot, even if you get the flu, it's typically a less severe disease.
All right, thank you so much, doctor. We appreciate it. Merry Christmas
to you.
Merry Christmas to you. Happy holidays.
Happy holidays.
Wash
Thank you for
those
having
hands.
me.
Yeah, absolutely.